All right, this is Sonia Brown, and I'm going to do insertion and removing of the nasogastric tube on Mr. Brown here. Okay, so first things first, let me make sure this is where you can see this. There we go. Okay, first things first, insertion is checking my physician's orders, making sure that I have an order to do the procedure. Okay, then we'll identify the patient, Mr. Brown, by checking his armband against the orders. Okay, we're going to wash our hands and we'll put on some clean gloves. Once we do that, we will get the patient up in the high Fowler's position because we do not want him laying down or choking on anything while we're trying to insert it. We'll get a drape and put around him. We'll act like we got a drape on Mr. Brown here. And the postal pass emesis will have a little cup of water or something to help him swallow. If you can't swallow, whatever. Once we do that, we will check his nose for patency. We'll ask him to breathe on, both sides. Make sure see which one is clear, not blocked by anything. Okay, and then we do that. Then we'll take. Once we decide our site, we'll do this one here because it's closer to me. And we'll get our NG tube out here. And we will measure from the tip of the nose to the earlobe and down to the xiphoid process, which he does not have. We will act like he has one anyway. We'll mark this little area with tape. Sometimes there are numbers on here. Yeah, there's numbers on here. But we'll mark this area with a little marker, with a tape. So we'll be sure not to go past that area, that number or whatever. Once we do that, we're going to loop this in our hands. So I can loop it right. And we will dip this tip in some lubricant. Hopefully it's water soluble or whatnot. And as we are advancing, we will ask the patient to take a deep breath and start to swallow. Just once they feel something at the back of their throat, we're going to ask them to start swallowing, and then we'll enter to the patient, and we will guide it. Tuck the chin. Ask them to tuck their chin and swallow, and we will guide it in. And we'll advance as tolerated. As long as they're not in distress, we will keep advancing. All right, and then what we'll do is, for temporary purposes, we'll place a little piece of tape just to hold it and see, and then we will aspirate some gastric contents and verify the pH level with a strip and get a chest x-ray. Once we're a little confident that we have it in the right place, we'll take the tape and we'll secure it to the patient's nose, like so. Then we'll attach our tubes to suction or feeding or whatever it's for. And then we'll wash our hands. Remove our gloves and wash our hands. And then we'll record the procedure. We'll document how the patient tolerated, what we attached it to, which side of the nose was used, and the gastric contents, and that verification of the placement with the chest x-ray and everything, and how the patient responded to all of that. And that is inserting the nasogastric tube. Now we're going to remove it. We're going to verify the order again that the patients need to be taken. The nasogastric tube is going to be taken out. We'll explain the procedure to the patient. We're like, Mr. Brown, hi, check his armband, make sure it's him. I'm going to remove this thing. I know it was horrible getting it in, but we're going to take it out today. We would wash our hands, put on some clean gloves. We will disconnect everything from the food suction or whatever we had them connected to. We'll remove the tape. We'll tell the patient, all right, after we put a little towel or drape on them so we don't get things everywhere, we'll tell them, say, hold your breath, and slowly remove the tube out of the patient. We'll dispose of this good tube, and we'll provide nostril care, clean his nose, give him some oral care. If he needs some oral care, clean everything out, get him nice and clean, and then we'll remove these gloves. We'll perform hand hygiene. We'll document how he tolerated taking it out. Of course, he will be happy, and we will leave the patient to do whatever he wants, and that is inserting and removing a nasogastric tube. Thank you.